Lasers have been the rock star in skin rejuvenation for decades. You have your CO2 lasers, your erbium YAGs, your ablative, your fractional lasers. You know what? They do come with a lot of downtime, a lot of risks, and they're not ideal for everyone. And here's where the Tixel makes its entry, and it's the hero no one sees coming. Now, lasers are light-based. They depend on chromophores. With darker skin pigments, they can definitely burn and scar, and let's not talk about the downtime. Now, don't get me wrong, I absolutely love lasers. I love the CO2, I love the erbium YAG, I love the fractional and ablative lasers. Definitely do. But does everyone want the downtime? No. That's where the Tixel comes into play. Tixel is a very simple device, very simple technology if you think of it. It's a metal titanium tip with little tiny pyramids, no needles, and just pure controlled heat. That is it. So it's very safe across all skin types, your Fitzpatrick 1 to 6. And I've used it for these different skin types and I've not had any complications in terms of hyperpigmentation or hypopigmentation, and the results are fairly great. There are a lot of clinical studies done on the Tixel and they do show dermal collagen remodeling. It helps with fine lines, textures, and they've also compared it to the fractional CO2 with similar results. Again, like lasers, you do require a few number of sessions, so 3 to 4 sessions to begin with to see significant results. But even after the first session, I have done it myself. I have tried it myself. It definitely helped with my texture, my active acne, and my acne scarring. This tiny little device and this simple little device is part of Brian Johnson's routine. Now, I'm not a big fan of the guy, but yes, a few of his protocols do work. His skin and hair protocol are great. Tixel isn't just about hype. It's about doing or getting close to what lasers can do. Collagen stimulation, resurfacing, acne scarring, but with less downtime. It also has fewer risks and it's inclusive. That's why for me, Tixel is quite the hero of my clinic and patients have been absolutely loving it. I use it for an alternative to surgical blepharoplasty. Obviously, it is not quite comparable to a surgical blepharoplasty, but a non-surgical blepharoplasty where it does help with a little bit of the eyelid lifting. It also helps with dry eyes. So if you do suffer from dry eyes, it's actually been FDA approved for dry eyes. It helps the meibomian glands release those oils and helps with any dryness that you have in your eyes. It's overall a very lovely device to have. Again, not for everyone, just like every other treatment on the planet, but it's great for most.